We had the first fully virtual conference from the ACC this
Hmm.
year, which actually went incredibly well. Hats off to the entire college for that. What do you think will be the long-lasting impact of COVID-19 on the college and its members?
You know, it's been interesting. I think we are learning that we can do things well, maybe a lot more quickly than we could previously. So, in many cases, we're asking for experts in the field to put together best practices, at least as far as they know, and get it to us and up on the hub and disseminate it to our membership with turnaround times of somewhere between 48 and 72 hours. And the fact of the matter is, going through a lot of evidence and generating a big guideline certainly can't be done in that kind of time frame. But I don't think it needs to take a year or two, which sometimes is the path that our guideline and science distillation takes. So I suspect we're going to take some lessons in speed. I think we're going to take some lessons in how to effectively have a bidirectional conversation with our membership and to be able to have a better ear to the ground of things that are emerging and taking the insights that they have and then absorbing them into the overall guidelines and standards that we put out as a college. I think we're going to learn a lot about virtual care. We obviously have had a huge acceleration in that just by dint of making sure that patients who don't have active infections or active cardiac or neurologic issues, by keeping them at home and out of our clinics, we've had to learn how to get on Zoom and talk to each other, how to maybe have our patients help us take them through a physical exam, and just how to sort of do it because it's the only way right now that we can take care of patients. So when we get back to being able to have the option in person, I think we certainly will. I still think a lot of healthcare will be delivered appropriately in person, but I think a lot less uh, physicians and patients will be hesitant to use a virtual strategy. And I suspect a fair number of patients, once they get a little bit of a taste of not having to drive to a clinic, sit in a waiting room, and all the brouhaha that occurs in a standard visit, but rather just sign on at their home and be done with it. I think they may opt for that strategy. So I'm hopeful that where virtual care, which is just one tool in our toolbox, could be useful, that we're going to have some acceleration of that trend as well. So I would think those are some of the immediate lessons that I think about. Um, and Yeah, I think the final thing is, at least in my division, I think this is true around the country and the world. I think our team is learning a lot more about how to work well together, how to trust each other, and how to improvise when we need to get stuff done. And although it's obviously a terrible situation that's causing us to do it, the long-term side effect of better team trust and performance, I think, will be a silver lining out of this.